and maybe chat into Kira to make sure you can hear us. We'll do introductions and then we'll get started in just a minute. I think she does. Are the slides up here? All right, so just as some kind of technical information as we get started, we want to make sure that everyone has an opportunity to be heard if they have a question. We will also have a couple of polls towards the end of the conversation. Please, as much as you can, use the chat box function to ask questions. I believe there is also a raise hand function on the webinar as well. So use that, and we will take some pauses throughout our time together today to make sure that we can answer questions. We may not answer it right away, but we will. You should have. We're hearing a bunch of feedback. I wonder if folks can check and make sure that their line is muted. I want to make sure that everyone can hear us okay. Okay, now we're muted. If you can hear us well, will you make sure and give Kira a little yep in the chat box? We want to make sure that all the disturbances are mitigated if possible. Awesome. So I'm Laura Alfani. I am the home visiting leader at the Department of Early Learning. I work with a fabulous team here at the department. We are the Strengthening Families Washington team. Not only do we do home visiting, we also hold all of our child abuse prevention work that is related to public awareness campaigns, parenting education in local communities, and there are several of us in the room as well. So I will do a quick, we'll do quick introductions in the room so you can hear us. Is it worse? All right. We're obviously still settling into technology, so thanks for your patience. So we'll do quick introductions of Elise, who's on the camera and who's in the room that's helping us facilitate the webinar so that you know who we are and can call out names if you need. So Laura Alfani. Renee, will you want to go next?
I'm Renee Wilson.
And I'm Kira Ingraham.
I'm Debbie Carr from the Contracts Office.
Cassandra Kugler from the Home Visiting Team.
Awesome. And as you know, we work in great partnership with Thrive Washington. You want to check with her on that? Thrive Washington and the Department of Health. So those folks should be on in various capacities as well. Genevieve Stokes is also on from our team from the Impact Hub in Seattle, which is a Seattle office that we have for some folks who reside there. So wanted to kick it off by thanking you for joining us today. Yeah. And just noting some of the things that we've worked through in the last few months since we've announced the transition. So since we announced the transition, we've hosted one webinar. This is our second. We've also talked with you all at the all-cohort meeting. Our director, Ross Hunter, came to the all-cohort meeting and gave an address and shared a few of his thoughts about the vision of our department and the world of early learning that we'll touch on a little bit. He reminded us of his goal of 90% of all children being kindergarten ready, and that home visiting is an integral part of the strategy for that as well. We listened to you on several focus groups about data reporting, data collection, and invoicing, and all of those inputs, both at the all-cohort meeting in November and the focus groups that Renee hosted, have given us great input and brought us to some of the content that we've developed today that we'll share with you. Want to just kind of highlight a little bit of what we'll be talking through. We'll talk a little bit about the vision for the future of the Home Visiting Services account, progress made on the transition since we last talked, as well as share some of the things, the nuggets that we've learned from you. So let's start first with the vision for the future. The decision to shift the contracts administration has happened over the last few months and shared with you last fall. Is really building on the foundation that Thrive has set. with the public and private investments to establish the home visiting services account contract structure as well as the implementation hub. And we believe to grow and continue to build on the footprint of home visiting in Washington State that we are excited to build in the contracts here at the Department of Early Learning. So we have sort of 3 major priorities over the next 12 to 18 months and many other things that will be coming along with it. But these are 3 that I want to highlight that the executive leaders and we have shared. So transitioning well so that we position the contracts into an opportunity for growth and integration into the portfolio of early learning systems in our state structure. Also building on evaluation and program outcomes and improvements, as well as assuring ongoing quality of services, so that we can continue to seek funding and continue to understand the impact of our programs and communities. We also are focusing on understanding our workforce, both understanding the capacity and the characteristics of the workforce so that we can build and integrate our workforce into the early learning workforce that already exists in our state. So that's the future. Through Renee's detailed analysis of all of your input from the all cohort as well as facilitating the focus groups, we've really been appreciative of the insights and feedback that you've given us so that we can integrate it into the materials, some of which you'll hear about today and you'll see in the coming days, and some of which you'll see in about a week or two, a month or so. So please know that some of the information today is technical in nature, and we appreciate you sticking with us on this, so please take notes, chat in your questions, and we'll address them either today or in the coming weeks as well. We know that this part of your work isn't always the most fun, the administration and the technical components of the legal agreement that is what it takes to get there in communities. However, we know that the heart is serving families, and the heart is for us and for you to be able to do that well and that be the focus of your work. So what we hope is that this information today will help us efficiently transition contracts so that we can continue to focus on serving families well. Next slide. Thanks, Kara. Elevating it up one level, we wanted to share with you how this fits into the Department of Early Learning's other work. The Department of Early Learning, home visiting is sort of budgetary-wise a small fraction of our work. However, it is highly visible within the portfolio of all of the larger services and supports for families. We have our large state pre-K program, our early care education assistance program, which is set for expansion until it reaches the population that is entitled to reach it in, I think, 3 more years, 2020. We have child care licensing, which is the bulk of our workforce of the Department of Early Learning, licensors that are located throughout the state and ensure health and safety and quality of early care and education settings. We also have early achievers and working connections that supports families to have access to and quality child care. We have our early supports for infants and toddlers, which is one of our sister programs and really does high quality services for families with children with developmental disabilities. To support all of that, we have a whole team focused on professional development, racial equity, and research and analysis to make sure that our work is all integrated. We're focusing on the most vulnerable populations, and we're understanding the work that we're doing. Am I taking it up here? You got it.
So this is a summary of today's agenda for our meeting, and hopefully I'm not booming across this because I think my voice is a little bit louder than Laura's. But we're going to start out by talking about the introduction of purpose, which we've done. Review the transition timeline, just so you can ground yourself in the timeline that we sent out last October, November. Talk about some key changes in the movement of Thrive to Dell in terms of this first set of documents that we're going to release. And so we're going to focus on the capacity assessment. The contract, we're going to focus just on an element of the contract, which is the general terms and conditions, which is the part of the contract which Thrive puts in their general agreement. We put it as an exhibit later on in our contract. We're going to focus a little bit on budget and on data sharing agreements. And then we're going to give you a preview of what's happening in our February webinar and documents release, so you can see the whole picture of all the documents that we're trying to pull together as part of this whole contracts package. And then the really exciting part of today's webinar is the release or the go live of our Dell home visiting website, such as it is, but what the information we've been able to feed to our communications folks. So that's our plan for today. It is being recorded, so you'll be able to review this webinar later on or share it with other folks. And if you haven't gotten the materials, you should have them as an attachment so that you can see our notes, and there may be things we refer to that you'll be able to keep after the webinar. So just the next slide is just a reminder of the context of all of the transitions so that you can get a sense of what this contract transition means for you. We know overall contracts administration is moving from Thrive to Dell, but that doesn't happen until July 1st. We can see that from this chart. Then monthly and quarterly reporting, again, will also move to Dell after July 1st. The TA supports and training, there's going to be no change between this year and next contract year, as well as the funding levels. There will be no change. There's a really small change in terms of the data and evaluation in that DOH and CCHE now take the lead on that this year. After July 1st, DOH will be the primary organization taking the lead on data and evaluation. So next slide, Kara. Here's a revisit too of the transition timeline. I finally learned how to use Visio, so I made it look a little bit better than the last one, although it's kind of blurry on this slide. What we've been doing up to date has been teaming with Thrive to thoroughly understand really how pre-contracts, contract development, monitoring have all been implemented over the last few years, because we want to develop a process that's familiar to you but also aligns with the state regulations. So we've really appreciated your input in informing our planning so that when we move forward to think about making changes, we've had some good insights from folks on what changes we actually shouldn't make versus what would be helpful. But we continue to welcome input as we move forward. So part of the purpose of this our webinar today is to show you what we're thinking, to show you the documents, and then to get, if you really have some solid feedback on them, we're open to that. These are still draft documents. So that goes for this set of documents that are going to be released early next week, and the set of documents that we want to release at the end of February, beginning of March. Some things we can't change because we're held to statute as a state organization, but there's a lot of things that we can move around or switch up. So we're continuing to clarify the roles between the three major partners in the HVSA, Thrive, Department of Health, and Department of Early Learning, particularly when it comes to information and reporting flow, and as well as how we're communicating with each other, because we want to minimize the amount of duplicate communication that you all are going to need to do with us. So that's our goal, and that's where we've come so far, and we're continuing to do some of that dialogue. But looking at the timeline right now, if we focus first on the first phases of the contract development here, we're looking at the pre-contracting phase, what the general terms and conditions are, how to develop budgets, and how to the impacts on data sharing that some of these changes are going to have. So that's what we're scheduling for today's webinar, followed by early next week. What we plan to do is release those documents to you so you can see them. Since we decided, since we have so much content to cover, that rather than just do one webinar today, we were going to do a second one in February, which has been scheduled for the 23rd at 1 o'clock, where at that time we'll focus on the implementation plan that translates into the statement of work in the contracts, the reporting process in terms of contract reporting, how you report back to us in terms of the different deliverables, the financial reporting, and then the monitoring process. And so what we'll do then after that webinar in February is release a second set of documents that relate to all of that. Some of those topics we'll talk a little bit about today, but only as introduction, and then we'll get more into the detail on those topics next time. With both sets of releases, you should receive an electronic packet of documents that we hope you will share across your organization with the folks who it's relevant to. And certainly if you have any comments or questions at all, we're going to be holding, if you have comments or feedback, we're going to be holding office hours over the course of February and March. Actually, that's what I'm doing. And I'll talk a little bit more about the details of that later, but the idea is I'm scheduling a lot of time in my calendar over the next 2 months to hear from you, both if you have concerns or questions, or if you want to give insights back to us. In March, if you look at the timeline, we'll be sending you the final capacity assessment, which we're now calling the pre-contract questionnaire, and Dell's intake form. And we're going to ask you to complete those documents. At that point, they'll be final. We're asking you to complete them by early April. So the ones we're sending you now are not ones we want you to complete. We want you to review. But we'll go through this process of officially releasing them as documents to complete towards the end of March, and we'll ask you to, or towards the beginning of March, and we'll ask you to complete them in early April so that we can use that information to inform our contract statements of work.
I'm going to get a pause really quick, and I think we have a question here. Can you read it for us?
Yeah. So the first question comes from Aowen. I'm assuming that we will do our quarterly report due at the end of July for Thrive.
Yes.
The next question is, will these slides be available to us by email?
They sure will, and you can also download them, I believe. So if you toggle on the little control panel and use the red arrow button to expand the control panel, you should see a handouts button there, and you can just click on the blue hyperlink, and they should download right to your desktop, and you should be able to print them or save them as well.
Yeah, it's this bottom section here for people that are looking at my screen. If you download that, you can download it directly onto your computer.
Any other questions?
Okay, thanks. So if we go, no more, okay, so we just finished the April section on this timeline, which is you all completing both the intake form for DEL and our pre-contract questionnaire. Then we in May will release individualized contracts that, that are basically built from those pre-contract questionnaires. And we will also, while all this is going on, we've developed a staffing plan to begin to hire a few contract specialists who will help guide all of this work and develop the contracts, and also be your point of contact for any questions related to HVSA, related to contracts, reporting, finances, that kind of thing. And at that point, when we release your contract, you'll also be assigned a contract specialist, so that's somebody that you can actually work with. And we're hoping that these folks, they're going to have some areas of specialization, so that they will be able to work super closely with the Thrive model lead. So, for example, we'll have contract specialists who specialize in the NFP program, and they'll work directly with the model lead at Thrive for that, so that it eases some of that communication. So that's your go-to person. Then in June, what we're hoping to do is have all of this information assembled, both in hard copy as well as online, to have developed what we're kind of calling an LIA contract manual. So every kind of resource information that you might need to know, we'll have that available. In addition to having human beings who can explain it, we'll have the documents all assembled together in a place that you can find easily, with our goal of going live on the contracts on July 1st. So if we get the contracts out to you in May, we're hoping we can do the negotiation process in May to June. They get signed in June, and they'll be activated on July 1st. There you go. So any questions on the process before we start getting into the details?
We have a couple questions. Just a comment. For future questions, can you repeat the question before answering?
Yes, sure.
Okay. That's it.
The question was, can you repeat the question before answering it? Which the answer is yes. So we'll do better about that. Thanks for pointing that out, and sorry for not doing that on the first one. We'll make sure that Kira has a microphone by her so you can hear her a little better as well.
So the pre-contract phase is really the activities we all, as the HVSA, need to do in order to develop the contracts. In the Thrive model, Thrive would administer a capacity assessment a couple of months prior to their contract development, and you would all complete that and submit that back online to Thrive. Our process is very similar. I think if you, and we have a poll here, that if you have, the one thing you have to do is complete a contract intake form, which that's what our contracts office uses to register you within our contract system. And that's a pretty simple form to fill out. I think you have to actually fill it out by hand. But it just has organizational, you can fill it out.
Online, yeah.
You can fill it out online.
Back electronically.
So what that is asks organizational information that then Debbie Carr and her whole unit develops to create a line for you or a whole space for you within our contract system. The other thing is if you are not currently contracting with Dell or any other state agency, you do need to register with the Department of Enterprise Services. So we have a poll here to find out how many of you actually do have state contracts. And the question is, do you have a contract with DEL or some other state agency, or no contract at all?
So we've opened a quick poll. If you could take a second to complete that, that'll help us understand the workload that it will take us to set you up as a new contractor. And we'll leave it open for about a minute or so. Just take a second.
And while we're waiting for you to fill that out. So I have a website in here in this document that you would go to if you haven't become a payee, where you would just need to go and complete that form and submit it either electronically or fax it in. I've done it before when I worked as a nonprofit. So it's just a form you have to fill out, and it gets you in the system, and then it enables us to pay you. And it also sets up direct deposit within whatever financial institution you want us to pay. So it's kind of nice because then you just get paid. You get paid instantly upon approval of your.
Let's don't use the term
instantly. I shouldn't use it instantly. I mean instantly, automatically. All the process approvals have been done here. Once the funds are released, it's instant. But getting the funds released.
Folks have completed the poll here.
Yep. Publishing it right now. Okay, so the poll's been closed. It looks like 56% do, 34% don't with us, but do with another agency. Great, pretty good.
Fabulous.
Cool.
Thank you.
Thanks.
That's helpful for us to know.
And then finally, everybody will need to complete this HVSA pre-contract questionnaire. So you can go to the next slide, which I'm going to talk a little bit more about that in detail. That's one of the documents we're going to release next week. We're still kind of finishing touches on it, but our goal is to get that finished this week so that you can review it, and that you would then, once it's finalized, you can do a very similar process in terms of an online submission, just as you did with Thrive. More details on that process coming at the next webinar. The pre-contract questionnaire that we're going to be working with this time around will be shorter than the capacity assessment. We're going to have fewer questions that are only specifically related to building the contract. And I'm trying to read my notes here. Some of the questions will be the same, which relate to key deliverables on the implementation plan, like your staffing structure and supervision, outreach and recruitment strategies, the number of families you serve, which I believe is just driven by our contracts already, the number of home visits you'll provide, the description of priority participants, the service areas for your programs, and then your program and agency budget. Those won't really differ. We're going to add a few new questions, but not very many, just basically related to the frequency of the second visit of families in a month and CQI. So there'll be a few additions with that. We're going to take out questions related to context and community, but those questions will move over to either be something that you respond to as part of a quarterly report, or it'll be used by Thrive and TA planning through some assessment processes that they're developing. So the idea here is that we're going to hopefully make that pre-contract questionnaire a little bit shorter.
Just one note on that, because all of the contracts, all of the organizations that currently have multiple contracts, based on your funding stream, you'll have a single contract, single pre-contract questionnaire.
Yeah, yes. So the next question, actually, that's our next slide. You very nicely segued us into that. Currently, with Thrive administering the contracts, Thrive drafts the contracts and statement of work, and they draft one contract per fund source, so per cohort, essentially. And that while they are 12-month contracts, the start date may vary, depending on the quarter in which that cohort began. This was through the Dell Contract Administration. We're still going to do draft contracts and draft statements of works, just exactly like Thrive, but we're going to do one contract per agency where we incorporate multiple funding sources within the body of a contract. And there's one agency that provides two different program models, and they'll have two contracts. So I guess I should have said here one contract per program model per agency. And all of our contracts will be 12-month contracts, and they all will start on July 1st. So everybody will be running on the same calendar. So that means when we administer the capacity assessment, now the pre-contract questionnaire, everybody will be doing that at the same time. And then we'll be issuing contracts all at the same time. And then the monitoring process will be all at the same time. So we're going to talk much more specifically about the statements of work in our next webinar. Before I move on to this slide here, are there any questions about the I told Kira to move and then I forgot to really ask for questions. Are there any questions? Either about the questionnaire, pre-contract questionnaire, or this change? Okay. The next contract just goes next one back. It's okay. This one just basically says you will see differences in the way our contracts are organized. One of the things I wanted to highlight that I forgot to on the last slide was that you may have more than one fund source, and we'll separate out within a budget. We'll see that, and we'll talk about that on the budget page. But if you have multiple, like McVie fund sources, those are going to merge into one McVie fund source. If you have multiple state if you're part of different cohorts that have state funding, a couple of different ones, those will all merge into one state funding column. So it's not like you're going to have 5 fund sources anymore. Not that anybody has 5. Some people have 3. But the idea here is that we're going to try to simplify within each of the national, the TANF, and then the other state fund sources. It's really the most fund sources you could possibly have are 3. So
right now.
And that's probably true now anyway.
So but, more money.
Yeah. So that's being said, the way Thrive and Dell organizes their contracts are slightly different. And in what we're trying to do, it's all the same information, but it's just we have a different way of ordering than they do. The first thing you'll notice is in the difference in the contracts is that Thrive's general terms are part of the general agreement that they introduce at the very beginning of the contract. And so their first section of the contract may go 7 or 8 pages long. Our first section of the contract maybe is 2 pages long because our general terms and conditions are an exhibit that come later. So in the contract. Then Thrive uses schedules to organize all of the different aspects of the contractual agreement. Dell, as a state agency, uses exhibits, which then are referred to out of that agreement. The first exhibit is always the statement of work, which is in a lot of ways comparable to the implementation plan from the Thrive contract. But it will also include major deliverables and the data and collection and reporting sections that won't be separated out in their own schedule. So that statement of work will be a lot longer than the implementation plan in the Thrive contract, but it will have a lot more in it just because that's the way we organize things. And then we have a separate exhibit for the budget, whereas that was part of the first Schedule A in the Thrive contract. That's all followed by the general terms and conditions, and if I haven't put you all to sleep by now, I'm almost done with this slide, which is, so we have the general terms and conditions, and then we have we'll have a lot of attachments that refer to the scope of work. So, for example, we may have more detail around data collection and reporting in an attachment. We may have more, all the federal certificates and assurances will be attachments, that kind of thing. So we're going to go into a lot more detail on actually what goes in the statement of work at the next webinar. So, but just because, go ahead now, Kira, because I know you're all just dying to know, what are all the differences in the general terms and conditions? Not really. I spent a lot of time trying to compare them so that, just so that I can answer questions if you have them. By way of context, I wanted to introduce this one page with saying that as a state agency, we're mandated to act as an agent of the state's taxpayers. And so we use guidance from the state's RCWs as well as from federal uniform guidance to drive the development of some of the ways that we're structured and the terms and our general terms and conditions. And so because of that, we just have some different accountabilities and authorities that we have to attend to. And you'll see that as evidenced in our long general terms and conditions. The other thing you'll notice, well, actually, before I get to that point, I wanted to say that Dell uses different sets of templates for its general terms and conditions based on who the entity is that we are funding with using those dollars. So you'll see a different, depending on who you are, you get a slightly modified version of those GTCs. If you're a nonprofit, you get a longer version. If you're another public entity, that's slightly shorter. And if you're another state entity, it's just slightly shorter because we already are abiding by those regulations, so we don't need to put them in the contract. That's the main rationale for that. But for simplicity's sake, there actually are a lot of templates besides that. And Debbie's looking at me. We've decided, for simplicity's sake, to use the federal template for federal funding for everyone. Now, that may or may not relate to some of you because you may not get McVie funding right now. But we don't know if, you know, that funding formula might change. And so we're keeping, just partly to keep our lives a little bit simpler, but also to allow for that potential change across in a year, we are going to use the same template for everyone. Now, the sections that specifically relate to the requirements that we have to abide by that are federally funded are all begin with contingent clauses like if you are federally funded, blah, blah, blah. So within the contract, it may sit in there and it may not relate to you, but the contract excuses you essentially from having to abide by that if you're not federally funded. So that's the reason we kept those terms in. If they're in and you're not federally funded, don't worry about them. The other thing I wanted to notice is that a lot of the terms that are in Thrive's contract are exactly the same as the terms that are in our general terms and conditions. They're just ordered differently, and in a couple cases we use different words. But for the most part, almost everything is in both. And Thrive went into more detail in a few things, and certainly Dell goes into a lot more detail in a couple areas. And those areas are up here on the slide, and I'm not going to go into those detail, but I certainly will talk to folks about them if you care, but I just don't want to put you to sleep. You can see, though, that there's just some areas where there are key differences, and we expect that when you read through the general terms and conditions, which is always advisable, if you have any questions, give us a call, and either I can help you with that, or I'll get Debbie to help us answer some of those questions if you have any. So before I go on,
Give me the look.
I know I'm giving Kira the look. Any questions about, I think, the contracting your GTCs? All right. How are we doing for time? Oh, we're even doing good on time too. So the next slide we're going to talk about is budget, and our budget template we're going to use is really, really similar to Thrive's, but there's going to be a couple of big differences. The first thing is you don't have to fill out multiple budget templates for multiple fund sources. We're going to all put it all in one, and we're going to use we're going to break down each funding stream as a column. So in the budget, you may see your McVie funding and your TANA funding or your other state funding all as columns, while the rows will all be very similar. The expense items will be the same, but you will see that broken down across the different fund sources. And we're really interested in also seeing a fourth column, or it depends on how many fund sources you have, but a fourth column that's really everybody else that's funding your project, so that we ask for that budget template, or Thrive has asked for that budget template every year as well, but we want to incorporate it into our overall budget template so we can see what percentage of the HVSA funding really supports your entire program, and where you're seeking other funds to support that. And that gives us a reality check, basically, to see, well, how much are we driving or impacting your project in terms of our funding versus how much are other funders doing that. And that gives us a sense of our reach. And then I think that's, for this slide, I was going to go into invoicing procedures, but we're going to really talk about invoicing the next webinar. but what you'll do is that template for the budget will serve as the template for our expense report on a monthly basis. And we'll ask you to submit monthly actuals with some documentation behind that. And then at the end, sometime towards the end of the second or the end of the third and fourth quarters, we will do more in-depth financial monitoring. And again, that's part of the next webinar. So,
pause there really quick. It sounds like we have a question in the chat box.
Oh, looks like it's just a comment. We wait to change slides until after questions.
So we will try. That's between me and Kira. I'm giving her the eye way too soon. Yes. Yeah.
And remember, the slides are available for download as well in the control panel if you're wanting to print those out and take notes on them.
And the budget format is one of the documents that, so I actually haven't said this, we are going to release the GTCs to you, and we're also going to release the budget template to you next week, so you'll get a sense of that. And if you have any questions, you can certainly call me.
Okay, we just had another question. Did you just say that financial will be billed monthly instead of quarterly?
I did just, okay, the question was, did you just say, will you be billed, what was the question?
Did you just say financial will be billed monthly instead of quarterly?
Will financial be billed monthly instead of quarterly? Yes, financial will be billed monthly instead of quarterly. And that actually, let's see, do I have? Oh, I have a payment slide way down, way later, where we talk about that in more detail. So.
Okay, yeah, we'll get back to that, and the next one is also in the same vein, so we will.
Okay. Yeah, we'll get back to those questions because I have that. I should have put the payment because I created these slides kind of following the process, and we're creating the budget, but we haven't paid you anything yet. So this is just creating the budget. So we're going to get the payment in a few slides. So the next, unless there are any more questions on budget, the next slide just has to do with execution. So you can go ahead, Kira. I will be very clear. Here you see both Thrive and Dell execute contracts. Oh, I skipped. Oh, I totally skipped one. Thank you. The next slide is contract assistance. This year and in the past, if the TA related to your contract has come from Thrive. Now, while the TA situation isn't changing in terms of your program quality and program implementation, TA related to your contracts will come from Dell. And that's where you'll have one contract specialist who you will become best friends with, and if you have any questions at all, that's the person that you'll be able to touch base with. And again, like I said earlier, that person will be working closely with the Thrive model leads and also with DOH. So hopefully they will be able to respond to a lot of your HVSA questions. But if you, you'll keep that relationship you have with your TA model lead as well at Thrive. That's not going away. We're also going to be developing a contract manual, as I think I mentioned on the timeline, to help provide resource materials for you in implementation of the contract. So, any questions? All right. Sorry, now we go to execution. Thanks, Laura. So as we said on the timeline, we're hoping that we'll release the individualized contracts in early May for your review and negotiation, and that those will be signed in June, and that then ready for execution really to go live on July 1st. The only, there's a few small differences, and these are contractual differences, is that you all have had 45 days to submit your insurance certificate. DEL requires those be submitted, the most current version of the insurance certificate be submitted 15 days into the contract period. So that'll be due July 15th. And then every time they update, they're due within a couple of days, or within 15 days of that certificate being, you know, because you all get insurance at all different times of the year. So it's whenever those insurance certificates are revalidated. The other thing is that you submit, we also want a copy of your independent financial audit, or A133, or single audit, however you, whatever it is that you provide or do within your organization. That typically was submitted with your first quarterly report at Thrive, and we're asking that that be submitted with our first monthly report here when you do your monthly report. And that's it for that slide. Any questions?
What if your audit is not performed until later?
What we just want is your most current. What if your audit is not performed until later? We'll ask you to submit your most current audit. And so, and I don't know if we've decided if we want you to submit it when it's new or if we'll just wait until the following year to say submit it again. So, we'll just say every July or August, 20th or something, submit your most recent audit for the prior year. So that may be that your audit's in September, and so it'll just be 11 months old at that point. But that's when we're asking is that we just get that submission. You can certainly submit it early if you want. But, yeah, just whatever you have.
Okay. Next question is, governmental audits are on the state website. Can you access them, or do you want the link?
I think Sherry does that. I
Okay.
think she does have a link for those.
So government audits are on the website. Can we access those? And we're thinking we can access those. So we'll definitely let you know if we can.
Yeah.
So
You can talk to Sherry about that.
yeah, that's a good question. Any others? The next slide, and again, this is one that we'll go into a lot more detail next webinar, but I just wanted to show the process and how the process is, changing or not between Thrive and Dell is reporting. And so Thrive, the current way that Thrive, the reporting structure is that you submit monthly enrollment reports and expense estimates, and then in quarterly, you submit an implementation progress and you submit expense actuals. With DEL, what we're actually asking is that you submit monthly. You keep the enrollment as with Thrive, but that you're submitting expense actuals monthly. And then on a quarterly basis, you wouldn't submit actuals for expenses, but you would continue to submit the implementation progress report and a reflection on enrollment. And these are documents that we'll talk more about at the next webinar, but it's just basically saying, some things are going to, our quarterly reports are going to stay similar, but they're going to change a little bit. As I said, we're moving some of the things from out of the capacity assessment into the quarterly reports, and we're taking some things out of the quarterly reports. There's change in these documents, but this is kind of the reporting process for how things will flow.
We do have a question.
Yeah.
How soon, or first up is, what will be the monthly report due date?
What will be the monthly report due date? We haven't figured that out. We haven't figured that out yet. So we'll let you know. Next webinar, we'll tell you.
Question noted.
Yeah.
The next one's kind of on the same line. How soon after the month is completed, as our county financials cannot be ready for at least 3 to 4 weeks?
So how soon do financials need to be reported, as county financials can't be ready 3 to 4 weeks? So we actually totally get that, because I used to actually do this for a nonprofit, and I felt like I had to do financials way before we'd closed out our month. And so looking for input from you all in when the best time is to submit financials. I think we want them to be accurate, so pushing it later in the month gives that opportunity for accuracy, but it also delays payment. So,
and I might make a note here. So currently the way the monthly reports are for Thrive is that they're input all into the gift system, so both the financial estimates and the monthly enrollment. And we have an opportunity to say whether we want our invoicing process, which we call our A19 process, to be basically disassociated with the monthly enrollment, which we would review in conjunction with the A19, but they don't necessarily have to come in together. And so we can talk about that as a team and talk more about that in detail in our next webinar. Whether the enrollment reports may be due something like the 15th, but the actuals may not be due until by the 30th of the following month, or the end of the following month, or something like that. So, so we can talk a little bit more about that. But our system will not, because the invoicing system will not be gifts. Those don't necessarily have to all be associated. So we can talk a little bit more about if that makes it more complicated for you, or if it would make it more efficient for you. And you can chat in any thoughts about that right now, and we can kind of aggregate those and talk more as a team as well.
we definitely wanted, and I have heard that at least for one organization, that monthly invoicing is problematic. They'd actually like to see it more frequent, and so that's something that I I think we can look at a case by case and talk to each of you individually and figure out what works the best. We can't front money, but we can certainly maybe go to a 2-week invoice if that's, if that's what you need. So.
And do check with the physical officers because there are some requirements, and I believe our contract says not more than monthly. So I think because of the workload, if everybody wanted to bill every 2 weeks, it would be horrendous workload.
Really for the small nonprofit, in most cases. So
Okay.
please let us
check with them and then see.
Yeah, this is something we're still working on.
Yeah, we've had a couple feedback on that. If you're asking for actuals, the timeline needs to be later. Another person said we usually have 25 to 30 days after the month to submit actuals. We've got another one that, yes, that would work better for county agencies around financials. We do have another question that is, what happens when expenses aren't identified or doesn't get into a monthly report? How is that going to be reconciled?
Yeah, I think that we'll have to figure that out. It'll likely be as a supplemental in a later invoice, but it'll have to be called out. And we probably need to develop some more specific items, but that's probably just a cursory response at this point.
Well, and I don't know if we want to go to the next slide. The next slide is dedicated to payment, and it seems like all of these questions are on payment. So, and the last one was, what if expenses aren't identified on the monthly report, and so they basically, you don't get reimbursed for them. So we're still, like Laura said, we're still working out that process. Yeah, we would want you to get reimbursed for all of your expenses. It just may be that it might be part of the next month's invoice, but it would be detailed as having occurred for the prior month. So let's go to the next slide. Are there more questions?
No, that's it. We will be compiling everybody's questions and comments and putting it together.
So did you hear that? We will be compiling all the questions and comments and putting them together. We'll update the FAQ, and we'll post it on our website as well as on Thrive's website. So these questions are actually really helpful because it helps us figure out what we need to talk about, what we need to work out. Hopefully, though, you will have a really strong relationship with your contract specialist. So if these kind of problems arise over the course of the year, we'll be able to start, we'll rework things so that it works best for everybody.
And I'll just note that the Department of Early Learning has nearly 400 contracts already. I think in the latest I saw something like 370 over the last year. So this will be adding approximately 40 new contracts to that pool, but we do contracts all the time, so it's not a new function for us. It's just fitting within the system that we have. So we'll have answers to these, and there's some things, again, that we can customize for you all and some things that we can't.
And you can see your contract specialist as kind of a liaison to that system so that they'll help interpret whatever those regulations are and try to make it run as smoothly as possible for you. So the next slide has to do with payment. And so this is where all the questions are. I probably should have put it earlier, but that's when the process, you get paid after you submit your reports. And so here is the answer to one of the initial questions is, Thrive paid monthly based on estimates. I think it depends on when you all invoice them. And then there was a quarterly reconciliation process. With DEL, we're going to pay monthly based on actuals, and there won't be a reconciliation process. But that being said, we want to make sure that we capture all of your expenses. So, and this was true. I know this from having been in this position recently. You close out your month, and then a bill comes in that relates to a prior month. And so you just add that into the next month's expenses and note that was for the prior month, but it just wasn't accounted for. So I don't want to go on this slide unless there's more payment questions. This is the one I want to make sure we've answered your questions as best as we can. If you have any more. Okay. So then the next slide, and again, this is something that we'll go into a lot more detail in at the next webinar. But in a nutshell, we're looking at, this is the structure for the monitoring process. We'll look at monthly reporting, and the difference is Thrive asks for monthly enrollment. We'll just review enrollment and expenses, so that'll be part of the monitoring process. On a quarterly basis, Thrive was reviewing progress through your implementation quarterly report and expenses. We're going to review progress and have you reflect on your enrollment numbers. So we'll have you look at a quarter's worth of enrollment numbers and reflect back to us based on what Department of Health has reported your enrollment numbers are. And again, And then annually, we'll conduct a site visit and do an in-depth financial review, just the way Thrive has been doing it in the past. With the whole overall, kind of the big picture view is that on an ongoing basis, we're going to be monitoring deliverables as they're identified in your scope of work. So, and that's what Thrive's been doing. So, any questions about the monitoring process? And we're still working all this out, so we don't have details right now, but that's kind of what we're looking at, our target. So, pretty vague.
All right. Oh. So we want to inject some more excitement for you all in changes coming for the next year. Something that we're excited about and that fits within the objectives of the organization and the goals of our leadership, both at Thrive and Dell at the Department of Health, is to be able to do more comprehensive evaluations of our program within the context of both how the program is doing itself and in the context of how the full system of early learning and tied to kindergarten readiness. What's home visiting's contribution to kindergarten readiness? And at this time, we can't really make any statements about that based on our current data structure. So something we'll be doing in state fiscal year 18 is obligating our contractors to share identifiable data with the Department of Health. Right now, the structure is de-identified data. In future years, it will be identifiable data. And that is all obviously within the constraints of HIPAA and FERPA rules and regulations and within the security protections that are necessary to manage this kind of data. The Department of Health obviously is well positioned to do this. They do this kind of work for many, many other areas of work in their own shop, as well as supporting other state agencies. So we'll continue to have the capacities for evaluation, reporting, and continuous quality assurance and improvement. And the Department of Health will share identifiable data likely once a year or twice a year with the Department of Early Learning to link it to our other administrative data sets and connect it with kindergarten readiness data at some point. The data that will be shared with Thrive will continue to be sort of the aggregate reports without identifiable data, and with DOH will be supporting all of the data management. We're looking forward to what this contribution will be to our whole system and what we think we'll be able to do in the magnitude of building our capacity for growing our system. So that's a big change, and I'm going to pause and see if there are any questions coming in about this. Please note that we will be sharing the templates of the data sharing agreements with you all in this first release, February 1st as well. That will be the Department of Health template that they have a standard template for sharing data that they've basically customized for this particular circumstance. And because we know that that is one piece, like the general terms and conditions that often require more extensive legal review, we want to give you the opportunity to see that earlier. We will still ask that you funnel questions about the data sharing agreements to us and to Renee, and we'll share an email account that at the end that we want you to share questions with. And then we'll support your connecting with the Department of Health until the time in which you really need to connect with them directly on those questions. And again, still maintaining the same integrity around data security and even more in the future. So, anything else?
Hey, I'm just wondering, go ahead to the next one. I'm wondering if we should be using the HV inbox instead of my email for questions from today. Instead of, okay, so I'll make a mention of that. So this is just a review of the documents that are going to be released so that, and I've been thinking I probably am talking way too fast, so I'll try to talk slower. This is what's going to happen in the next week is we're going to release the DEL contract intake form, which I have here says the system form, the HVSA contract, we changed the name this morning and I just didn't catch it on this slide. So we're going to release the intake form for Dell, the pre-contract questionnaire, the general terms and conditions, the budget template, and the sample DOH template for the data sharing agreement. That's what's coming to you next week. We're going to email that out. Then in early March, we're going to email out a kind of generic statement of work, the monthly and quarterly reporting forms, the financial reporting forms, and go over the monitoring process with you. Maybe there'll be a monitoring checklist and that kind of thing. So our question to you is, who should be receiving the packet? We don't have a poll for that. So I think if you could chat that in.
Or if they want to email the whole business.
Yeah. So that's where we were just talking about. We've created an inbox so that any questions that you have now or into the future of time, home visiting at DEL. It's home visiting, right? Home visiting.
Home.visiting. I'm typing it in right now.
Okay. Home.visiting at del.wa.gov. This webinar has my email. Certainly, you can email me if you can't remember home. If you can remember my name better than home visiting. But we'll update that and make sure that when we send out the packets, we'll have it sent from the home visiting inbox so that you get that all in your inbox. But we want to make sure that we send the packets get to the right people at each organization.
Yeah, we have a question. What are the first two forms that you listed?
So the first two forms are named incorrectly on this slide. The first one is the Dell intake form, which is what I talked about earlier. It's just it's a one-page. What's your organization's name? Your Washington UBI, your DUNS number, your contract monitors, name, email address. That it's really basic information. Do you have anybody who's currently employed by the state who works for you or who recently worked for the state? That kind of thing. It's just the form to get people into our contract system. The second document listed here says HVSA contract intake assessment. We decided that there were too many intake assessments, and we decided to call it the pre-contract questionnaire. And I talked about that earlier, but again, on this slide, it's incorrectly identified. So that's basically the capacity assessment reduced.
We'll correct this slide before we go to it.
Yeah.
We did have another question. It says, in the past, only 3 people were allowed on the mailing list. Will you allow more than that? At our agency, I can think of 5 people who should be on the mailing list, and I think it will facilitate this dissemination of information.
I'm looking at Debbie about how many contacts we can have within the CAP system per organization.
So the question is, how many people can be on our mailing list to distribute information out? And we're asking our contracts person.
We can put more names in the list than 3, but the system is pretty specific in who it will email on a regular basis to, and that one person is fiscal and the other is the contract contact person. So other people can be added to that list, but they wouldn't necessarily receive copies of the contract.
I'm just wondering if you can sit a little closer to the mic. Can everyone hear Debbie okay? Your voice is a little soft. I'm worried that
I think that's a good question that we haven't actually worked out the answer. Our contract system can put more than 3 people in, but it wouldn't send automatic emails out to more than 3 people. So we're still working that out.
And we can certainly have our contact list.
We can have them in there, but when we go to send the contract, it only picks up a couple names on there with the Dell contact and the contractor contact and their fiscal contact, so that we don't get too many people wrapped up in it. But you can add more if it's necessary. We could make it work.
We also had another question. It says, just to be clear, both of these releases are sent to us as drafts of these documents, not for us to fill out and return, correct?
Both of these releases are being sent as drafts, not as final, and that's correct. Yeah, correct.
We'll notify you when something is due and when it is due.
I'll try to be good about making sure that it says draft all over it too, so that you don't, hopefully.
And if there are multiple people who should receive this first packet of information, if you could send us all of those contacts. We have the contact list from Thrive, but realize that it's not always the right people for who needs to get things. So if you have preferences about who gets this release, please both either chat it in or email it to the home.visiting@del.wa.gov, and we will compile a contact list as well. And then we'll deal with it in our contract system the way we need to.
Yeah. Anything else?
Here's looking to see if there's any other questions.
Next slide. And this is where we'll update this. I just wanted to, I referred to this earlier in the webinar, that we're going to have opportunities where I've cleared time in my schedule so you can make appointments for 30 to 60-minute conversations where we can go over detailed questions if you have them. Once we send you out the documents and you want to go pour over them, I'm available to do that with you individually. And you can email me directly using this, or phone me using the information on this slide, or you can do, I also receive the emails from the home.visiting@del.wa.gov site, so I'll see it, I can pick it up from there. I've set aside these times on my calendar for the next 2 months to have these conversations. If none of these times work for you and you want to have a conversation, just send me an email and we'll work out a different time. That's fine. The only thing we're asking is that you would give us a little bit of a heads up of what your question or discussion topics are, so that if it's a super detailed something about GTCs, I can go find out that information from Debbie, because I'm a generalist on all of these, but I may not have the in-depth, deep knowledge needed to answer your questions, but I want to be able to do that at the time that we have it scheduled. So home.visiting@del.wa.gov.
In the chat box.
In the chat box. Any questions? Okay. No. And this is and again, I feel like I'm repeating myself, but I just want you to know that we still have yet to come a more detailed discussion of the statement of work, and I expect that to be a pretty long conversation since it's going to have a lot of information in it. We're going to talk about what our online reporting system will be, what the reporting process is going to be with monthly enrollment reports, quarterly progress reports, and the monthly invoicing and financial reporting. And then we'll talk about deliverables and financial monitoring in terms of all of that. Here's the registration information for that webinar here, and that will also be in the HVSA newsletter that's going out this week. So not to worry if you don't write it down this second.
Well, remember, they can always click on their PowerPoint.
Yeah, exactly. You can always click on your PowerPoint to find this information as well. Questions? Okay.
Do we want to do the poll?
Yeah.
Yeah, I think so. So these two questions have come up kind of on our side as we're working through and thinking about components of the contract. Is typically the Department of Early Learning does require background checks, at least for those who have unrestricted access. Is that right? To children? Am I saying that right? Anyways, background checks are required.
I was reading your little thing. I wasn't listening. What did you say?
I was asking about background checks. So we typically require background checks in our contracts. That has not been a requirement of the Thrive contracts, but our assumption is that most organizations require those as well. So we want to know if we do require that in the contract, what kind of burden would that be? So first, do you do it? And then help us understand what kind of burden that might be from the cost perspective. So if you can just take a quick second and complete the poll that's up on your screen. We would like to integrate this into the contracts, but want to understand the implications before we do.
Yeah, independent access to children.
We'll just give that another quick second.
Is it moving all around here? Or is it
Staying pretty steady. By far and away, most people do. Whenever you do background checks. So it looks like we'll give it another couple seconds. We've got about 65% of the answers.
Okay, great. So if you haven't completed it, I'm going to give you a quick burst of excitement to complete it. If you're checking your email, not listening, do a quick completion of the poll, and then we'll take that away. Is there a second poll as well, Kira?
What's the burden if they don't do it?
Yeah.
So if you don't administer background checks, if you do, you can snooze for a minute.
Yeah, this is just for those who answered no.
If you don't, how big of a burden is it for you to start? So 1 being not a burden at all, 5 being it'll sink the ship. So in terms of cost.
And process.
And process.
Administrative burden.
Yeah. And this is just on, I think, on new staff at this point. Yeah.
right, we'll give you just another quick second to complete that.
What did we hear back, Kira?
It's all over the board.
Great. Okay. And please feel free to email us about that as well, either Renee or the home visiting email as well. And
The next one isn't a poll.
okay, the next one is we want to include in the contract a parental consent form, particularly as it relates to the data. We're thinking a lot about making sure that families understand what they're consenting to, both in the context of service delivery and what they'll be participating in, but also with the data collection requirements. And so we have some templates of parent consent forms that we have, and would be curious if there's something that you use that you really like, and if so, please send it in.
No, that's good.
We'll pause really quickly and see if there's any questions, Kira, in the chat box.
No real questions, just comments on the lab poll. So
Background check.
yep, we can take that into consideration.
Yeah, we'll take all your comments that you just submitted in relationship to the background check. We'll incorporate those into our discussion after this meeting. Thanks a lot.
Questions?
Now, for a first look at the Dell HVSA webpage. I can't talk. HVSA.
So, Kira, are you comfortable if I turn the camera on you so they can see you?
Oh, sure.
So Kira and Genevieve Stokes, who support both our teams and our communication, lovely Kira there, and who's also hosting the webinar,
See if I can multitask.
been working over the last few weeks in partnership with Thrive to develop our website. And so what we're hoping for out of the website is that this is really the central point where you would access information. We have some specific structures on the page that guide you, but we're really excited to share it. And I want you to know that on this home page right here, you'll see the tile that is the home visiting tile. And in that picture is Kira's little guy and my little guy playing together last year in our Pinwheels for Prevention, Child Abuse Prevention Awareness Month. So I'll turn it over to you, Kira.
Thanks. So to get on to the new home visiting page, the best way, you can either drop down for the helpful resources and home visiting is there, or you can just click this tile. This is now what the home visiting page looks like. So we do have information for you about the transition. This is where, if you want to click for the full transition page, this will be where you'll notice the Q&As from the last webinar. We will be uploading the Q&As from this webinar. We will also be uploading the webinars themselves in this area as soon as I can figure that part out. We had some success earlier today with a webinar on domestic violence that we were able to upload, so it should be probably later today or tomorrow that we can get the webinars uploaded. And you'll also notice here is the email address for the home visiting inbox. So in this we have information for families. There's some quick links for them. There's also quick links for all of the home visiting models. This takes you to their national pages. Just basic information about the HVSA and some of our one-pagers, different bits of information. But the main thing that's probably going to interest you guys is going to be the home visiting for programs page. And this one is, we're still working on it. Some of these documents haven't been created yet, so they're not uploaded yet. But once all of these documents are created, this is going to be a portal where you guys can find them. So, and it will also have, you'll have information for the contract. Oops, that page isn't published yet. It's not ready. Just kidding. I think I can see it on mine because So this is where you will go to find all of the different documents that we've talked about today. It'll be live links. Hopefully it'll make it easier for you guys to find documents when you need them. You won't have to search through a search bar. They'll just be listed right here. And you can also always click to our partners. The three of us work together quite a bit. So this is links to their pages as well.
We'll also archive the newsletters, so you can, instead of digging through your email, can just go to the web page and click on them to find old newsletters as well.
Yep, we've got November's and December's already up. Are there any other questions on the website? Anything else that I'm forgetting to show?
I don't think so. I think this is the page where it says information for home visitors, and right now the tile is what we call them, says it's the red one that says for home visitors. So I think we're going to change it to say for home visiting programs. But that's the one where we anticipate you'll be using the most often, and we also are open to input on it. So if you have thoughts about what you want on there that you need or you go to most often, we're happy to.
Yeah, and we do have links to Thrive's page, but if there's stuff that you know that you look at Thrive all the time that would be beneficial to have on our site as well, feel free to email. I also have access to the home.visiting@del.wad.gov email, so you can always email suggestions, comments, documents that you would like listed to that as well, and we can make sure to get that up in there.
And our goal is to always have the most recent version of those. So if you're not sure if a document that you have is an old version or a new version, this is where we hope to have all of the new versions, and then we'll pull down and archive older versions of documents as well. So we have lots of production that we still have to do on documents, but Kira and Genevieve have done a fabulous job on the website, so thank you for that. And we'll pause, and I don't know if you can see questions that are coming in still from your webinar. Any other questions about, I think that this pretty much concludes the rest of the content that we had to share with you. So we'll pause and just give you a couple minutes to chat in questions. We have about 15 minutes left. We're fine with ending early as well. But please feel free to send in any last questions that you have.
Thank you. That's awkward.
Do you want us to want me to re-talk in English after having raced through all the information at the beginning?
Okay. We'll stay on the line for just another minute or so, and if folks have questions or want to hear if there's any other questions, you can stay on. We'll be here about 2 more minutes. I know for me, sometimes I'm always the last one typing in a long question at the end of a webinar. We'll be here for a second, and feel free to chat it in. If not, we'll be emailing out information soon. Please make sure we have your most up-to-date contact information. If not, we'll use the contacts that we have from Thrive to email all of the draft documents that come in the first package next week, as well as the subsequent releases of documents as well. So thanks for spending your afternoon with us. We know it's a post-lunch thing. I hope that we gave you a big rush of energy to get through the rest of the workday.
And as ever, if you have any questions, feel free to give me an email or email the home visiting inbox, and we'll make sure, because I know some people, that we just threw a lot of information at you, and as you digest it over the next couple days in your head, you may come up with other questions that you didn't think of today. So you didn't lose your opportunity. There's lots of opportunities still to ask.
And if anybody asked a question that I accidentally skipped over, just know that we will be going through all of these questions again and having full answers, and we'll be posting it to the website with details.